My name is Ronald Krauss. I am a professor of pediatrics and medicine at the University of California, San Francisco in California. And the presentation topic is the use of advanced lipid testing for evaluation of cardiovascular disease risk. And specifically, what I covered were the indications for going beyond the standard lipid measurements for evaluating risk in certain patients. The reason for this is because LDL cholesterol, which is the most widely used laboratory method for evaluating cardiovascular risk and also for deciding on adequate management of that risk, is not always informative, particularly in patients with type 2 diabetes. And this is a meeting of the American Diabetes Association. And so what I stressed was that the typical lipid abnormality in patients with diabetes is not characterized by high LDL cholesterol, but rather by higher triglyceride levels and lower HDL cholesterol, which themselves carry cardiovascular risk, but are not as such part of our current guidelines, which are focused on cholesterol, and we calculate risk based on cholesterol, HDL, and other risk factors. So the reason for this is because there are abnormalities of LDL in type 2 diabetes, but they're not reflected in the LDL cholesterol measurement. What we and others have shown is that there are LDL particles in the blood that are pathogenic, that are very strongly involved in the development of cardiovascular disease in these patients, but they're smaller than the standard LDL. They have less cholesterol, so they're called small dense LDL. They're less lipid enriched, yet they have enhanced atherogenic properties. And so these particles are kind of hidden beneath the LDL cholesterol measurement. And we require more advanced methods to detect them. Measurement of plasma ApoB, which measures LDL particles across the board, including these smaller LDL, is superior to the LDL cholesterol measurement. But what I described were other methods that allow us to zero in on small LDL itself as a target. Now, these tests are not widely available. They are available through a laboratory in the United States, a couple of laboratories in the United States. They're not necessarily widely distributed globally. So they may not apply to the practice of many of the people who are hearing this broadcast. But there are alternatives. As I say, plasma ApoB is a measurement that's generally available. And there's another laboratory test that is widely available that is also a high risk factor, and that's Lp(a). It's an LP in the small a in parentheses, which is another form of LDL that is very commonly elevated, not just in diabetic patients, and is strongly associated with cardiovascular risk of stroke, also risk of aortic stenosis. And this is also hidden beneath the LDL cholesterol measurement. You can have a normal LDL cholesterol, but a high Lp(a). And I showed a case study, one of my own patients, who had normal lipids, had a family history of heart disease, but who had high levels of small LDL as well as high Lp(a). And this is the argument that I gave for going beyond the standard lipid measurements to detect hidden risk that would be appropriately managed by either diet. In this case, it's not just limiting fat, but it's also limiting carbohydrates to lower the small LDL particles, which is can be very effective. But in many cases, this would also be an argument for statin therapy, which can override the risk associated with these factors and sometimes correct the small LDL profile. So that's the thrust of my talk. And again, there are patients out there, many of them, with normal or borderline lipids who I think would be candidates for this type of testing to help identify those who really should be candidates for aggressive management.